Tax season! Hey, what's happening now? If you need your taxes filed, I got to tell you what it is. Because why? I'm comedic narrator, the haircut slanger, Benny Mac. Now, when you get ready to do them, go by and holler at Katanya over at D5 Tax Service. 9729 Parkway East Side. What up? Hey, look, she can get you that money. And if you come down, Katanya gonna put you on a free trip. You can qualify to go to Mexico, Dubai, and anywhere that you probably ain't been until you get them taxes. D5 Tax Service. Now make sure you call her now to make sure she there, because they be having a line out the door. But she gonna be right on out there. 205-868-3139. Remember now, go in D5 Tax Service and ask for Katanya. And I'm comedic narrator, haircut slanger, Benny Mac, Big Chain Mac, man. And I approve this message.
Okay.
My mom got a lot of hair. So
Who they is? Who they
she used to head hair. She did.
Alright. I know that now. The good doctor told me.
That's a blessing. You know how many women lose their hair?
Yeah. I see. We cut women's hair also, so we have to keep them shaped up and looking neat, even though it's maybe thinning or.
You have to know how to
Turning
camouflage, because when folks come in, they have to know how to camouflage my little cowlicks when I wear the short.
There's women that kill for them ears. For
Yeah,
real.
they be doing that. My baby had to do that. I bought my baby some edge control. She got a daddy hair. He got real strong genes.
Well, she didn't get it from her mama.
And I said, well, yeah, baby, you got your dad in them hair.
Okay.
We live.
Hair do count.
What's up?
That's right. We live.
Y'all got some good
Barbershop
videos.
That's right. Welcome to another episode.
Episode 32.
Yeah, hold on. Welcome to another episode of Barbershop Stories, episode 32. I ain't gonna do too much talking because we probably about a few minutes late, thanks to Dr. Mills. I'm just kidding with you, but yeah.
Doctor was on
She
time.
was here early.
Yeah, she was on time. But no, we got a special guest in here, Dr. Mills. She's a medical doctor and gynecologist, and I know this conversation is going to be 1,000% interesting. So we finna come on up here, and I am comedic narrator, haircut slanger, Benny Mac, and that is.
Sammy don't know. Y'all know we keep the info for
That's
you.
right.
Ladies, where y'all at?
We're finna get on up here and just see
the
what
doctor now.
what old Dr. Mills
I'm
talking
ready
about.
to teach.
Yeah, how you doing, Dr. Mills?
I'm good. How you doing?
Oh, magnificent. We appreciate you accepting our invite to come on out here to
Oh, I
Barbershop
appreciate
Story.
you inviting me
Oh yeah.
to this phenomenal establishment.
Oh yeah. I ain't had a chance to clean up too good, but it's
That's
phenomenal.
all right. It's yours.
I can imagine what it is.
It
when
said
we get
Benny
it
Mac
cleaned up.
right there, so we good.
But right now, it's still half mine, half the mortgage company. But
That's all right,
I'm
baby.
just kidding with you. So what's up, Dr. Mia? The gyno of the year. I done heard a lot about you before I even met you. Heard you real good with what you do. You're great with your patients, and you have a huge event. We'll talk about that first, called the B3 Experience. So for the viewers out there that don't even know who you are, what you stand for, just give us a little background about Dr. Mia.
So, I am Dr. Mia, your B3 specialist and board certified gynecologist. I help women suffering with weight gain, fatigue, and low sex drive improve their quality of life through my medicine, my books, my blogs, my Facebook Lives, my radio show, and now my events. My goal is to help you experience your beauty balance and belief so you can always live well, age beautifully.
That's a real.
So basically, I'm a gynecologist and I teach you how to live a life of total wellness so that you can be an ageless belle. I teach you all about weight management. I teach you about supplements. I teach you about hormonal balance. And most importantly, I teach you how to maintain a very healthy flower. Some people say vajayjay. We're going to say flower because we don't want to get put off Facebook Live, okay? I want everybody to hear this. So the flower, I teach you how to maintain the flower.
And keep them yams and all.
Right, and I keep marriages together. I say marriages, vaginas, and lives.
Okay.
Dr. Mia,
Okay.
Me Bella Wellness Center.
Well, Ms. Dr. Mia,
Yes.
how do you plan to do that? You said you You saving flowers.
Mm-hmm.
You keeping marriages and stuff that together.
Keeping women happy.
How do you do? How you do that? I mean, through
Well,
conversation or you
keep
got
it in.
something?
It's complicated. It's real complicated.
Well, go ahead. They got time. Go ahead, share.
So I first start with physical health.
Mm-hmm.
So I make sure that everybody's doing what they need to for prevention of disease. They understand their bodies. They know what they need to do to prevent disease. Then we get into more of the wellness component of it, and then if they having some issues, I treat them with supplements. I try to do more hormonal balance rather than just throwing a bunch of pills at my patients. And then we start focusing on ourselves. I teach women that they are just as important as everybody else, and you can't take care of everybody else unless you take care of yourself. So putting yourself first is not wrong. You're actually doing your family a service when you put yourself first. Because in my household, God is first, and then it's me. Okay? And then it's my husband, and then it's my child. But before my husband and my child, it's me. And I know that I am a great mother, and I know that I am a great wife, but I cannot be that way if I don't take care of myself first. And make sure that I'm feeding myself and getting what I need, taking time for my workout, taking that time for my massages, doing my girls' trips, you know, but I still work just as hard as I play, but I put myself first. Like, I don't think my daughter is more important than me. God, then me. God, then me.
Well, that's
And most women have been taught that you take care of everybody else, and you just suffer and go crazy at the end of life and never enjoy all your hard work, and you just take care of everybody else and make sure your husband okay, make sure your children okay, and then screw you. You are a strong woman. Make it happen like your mama did. I'm not doing that, and I'm teaching my women not to do that.
I know you speaking specifically to the women, but shouldn't men kind of
I agree.
God themselves,
and then their wife, and then
we just make sure it's all okay. We just make sure it's all
But men don't tend to have a problem doing that.
Okay.
Man,
You know, women naturally are just more nurturing people. They're taught to put everybody. Men are taken care of. Like my dad was the first child in his family. But he was the man to everybody. You know, everybody took care of him. They fixed his plate. They did everything for him.
Okay, I got you.
My mother, they never did that for her. She was the one doing for everybody else.
Okay. I see what angle you coming from.
Right.
See what corner you playing out of.
But no, I didn't say she is fat. She did say the B3.
Yes, she did.
Beauty
said
balance
balance,
family.
yeah.
You got to
She
balance
said-
it out.
Okay.
She said now.
That's what the B3 stand for.
Yeah, B3 experience.
Beauty, balance, belief.
I not Mia.
Say it with me.
Beauty,
Beauty, balance,
and
belief.
belief. Y'all hear them.
All right,
What
now,
is it?
Yeah, beauty, balance, and belief.
God first and then yourself.
In yourself.
Then your spouse and your children. Your children come after your spouse. Read the Bible.
Yeah, that's what it's saying. Where is that the Gideon's version of the King James?
Nah.
They're trying to just
I listen to Messenger. It's much more plain and clear.
Okay, I just want to make sure now, because some folks out there, they get it.
Messenger.
Some folks stole that Bible out the hotel room. You got a point. Now, Mia, you said you got a huge event coming up.
Huge.
April 3rd and 4th, right?
April 3rd and 4th.
Okay, so look, I be paying attention.
You do.
Tell the folks about it, because I
It's
think
the
they
B3
gotta know.
experience. The teaser is April 3rd from 6 to 9. 6 to 9. 6 to 9 p.m.
Okay.
on April 3rd.
6
at the Avondale.
to 9.
6 to 9.
How you come up with that?
I just figured
6
women are off work
to
by
9.
6, and it's an all-female event. This one is. I'm going to have one for y'all next year by this time, for men and women. But I figured it'd be done, get the kids together, because, you know, you don't want to have to do all the scheduling. I'm just kidding. But, and then you'll have time to get there. We're going to have valet parking. You will not have to look for a parking place. Valet parking. You're going to come up, walk in. You're going to get your drinks. And you're going to get your hors d'oeuvres, and you're going to meet some fabulous women, and I'm going to teach you how to be real sexy for your mates or yourself, whichever one. And then we're gonna have some panel discussions, but most of it'll be a whole lot of fun and creativity, but with the focus on our own intimacy.
Okay, now, by you throwing an event like this, you're already in the medical field, so I'm sure you got enough eventful stuff going on in your day. What inspired you to say, you know what, I'm going to put together an event like the B3 experience so I can go further outside of the doctor's office and educate my folks?
Because I don't think it's fair for me to hold all this great information to myself. And not only me, like at my events, there will be physicians from all over the country that are coming to speak at the events and to teach. So it's not you just listening to me. I've got Dr. Lakeisha, who is a sexpert. I've got Dr. Cree, who is a family practice doctor right here in Birmingham. She has a direct primary care practice, and she will be teaching you about the importance of intimacy in marriage. She brings it from a spiritual perspective as well. I'm going to have the Dr. Jared off Married to Medicine. Yes, the beautiful Dr. Jared, who's going to have some great stuff out there too, that she is launching her new hairline, Honey Love. I'm going to tell you exactly what it is. So Dr. Jared will be there. And then I'm going to have some other people from all over the country, and they're going to teach you everything you need to know. I have a great dermatologist. I have somebody that's going to do mindset. I have somebody that's going to teach you how to dance like you dancing for your man, and it's just the two of y'all in the room. We're going to do some Pilates, because I'm going to teach you how to maintain your flexibility so that you can always have really good orgasms until you die. I'm going to teach you about vaginal health, how to protect the vagina, how to keep the vagina young and lubricated and orgasmic and sensual. Weight management. And I got my men coming because my husband is my male spokesperson. Did you get to see him a little bit today, Brother Joe?
Good people.
He good people. So yeah, I take care of men and women. So I do hormonal replacement therapy pellets for women and men. I do weight management for women and men. I do gynecology for adolescents and women of all ages. So if you are looking for a great one, come see me and go to the event. We're gonna then do April 4th. The B3 Experience, the climax. So that's the 8 to 4 event on Saturday at the Marriott 280. We're going to have great food, great prizes. We're going to teach you how to spice up your sex life. That's where a lot of the physicians will be talking to you all about being great and living a life of total wellness.
Okay, well, Dr. Mia, before we get into the meat of the matter, one question I got to ask. I heard you mention, you say you give folks pellets. Now, every time I hear somebody taking pellets, it's like, da-da-da-da-da-da. What are Dr. Mia pellets? And what are they for? Because you said men and women.
Men and women.
What are the pellets? Yeah,
so what women don't know, and some men, is that as you age, your testosterone levels start to decline. And you know your testosterone levels are starting to decline, which actually makes you age. So for testosterone, I call it the anti-aging hormone, and I call it the forgotten female hormone. For men, when you are young and vibrant and you feel great and your libido is off the chain and you don't have a pot belly and you still have muscle and you're happy and you sleep through the night, your testosterone levels are about 800 to 1100. When you're a woman and you're feeling that way and you're young and healthy and you don't have any problems with your sexual function, you're not having night sweats, you're sleeping, you're in a good mood, you're happy, you got energy, yours is probably over 80. So
is that the testosterone for women?
But that's the testosterone for women. Men have 10 times testosterone.
Okay,
men have 10 times of what we have, but when it starts to decline, everybody gets those same symptoms. So by replacing the testosterone, we get rid of those symptoms, and you are young forever. Like everybody's like, how do you do everything you do? Well, because I work real hard at it. I do my pellets. I just got mine on Friday. I waited 2 weeks too long. And you know what happened? I couldn't remember what I was doing. I listened to a couple of my patients' heart and lungs twice because my focus and memory were off because my testosterone levels had declined. I started back waking up in the middle of the night. Had started back with night sweats. You know, function still good. Joint pain. I hadn't had to take anything for my joints over the last couple of weeks. My joint pain came back. And then I said the focus and memory and mood. You know, people starting to really get on my nerves, and I'm less tolerant of, you know, stuff that happens every day that doesn't bother me when I have good testosterone. For men, the same thing. Y'all get moody. You start gaining weight in your belly. Y'all don't ever really lose your sex drive as much as women may have a low libido. Men may just have a slightly lower libido, but they may just not perform as well as they used to. Which is normal aging. So low testosterone is a part of aging. When you age, it declines and those symptoms come. But if I replace it, you feel great, you have lots of energy, you're happy, you're motivated, you're still trying to go farther and farther in your professional career because you're confident, because you can remember what you just said 5 minutes ago. You know what I mean? So I think it's for overall quality of life, and I felt like I had to do this conference, and I've got to put myself out there more nationally and internationally because I want women and men to know that you can live a life of wellness and enjoy your life and still experience intimacy if you are 90 years old. And then you can still do the things that you enjoy doing, which will change as we age. You know, I used to like to go out and kick it real hard all the time. That's not what I enjoy anymore, but I want to be able to do what I do enjoy. And a part of that is hormonal balance, taking your supplements, getting your exercise in, eating healthy, maintaining a healthy weight, like all the stuff your mama told you to do or not.
Well, let me ask you: is that that 10-time difference in men's testosterone level? Could that be a reason for men having that sex drive? Well, they want to tap you on that shoulder when you
right. But see, the thing about a lot of women is they on birth control. So when women are even on birth control, it decreases your testosterone levels. So women who are on birth control, so like the Mirena IUD or NuvaRing, the patches, the pills. Depot shot, all of that suppresses your testosterone, and that's when you may notice night sweats, you may notice problems with sleep, decreased sex drive, but it lowers your testosterone. And for men, theirs naturally lowers about 45 to 50, and for some men much earlier. The average woman, it can be in her mid to late 30s to 40s. So replacing it just keeps you young and healthy and vibrant and enjoying intimacy for the rest of your life and maintaining a healthy marriage and having great relationships, because you only get certain endorphins from orgasms. And without orgasms, your body will not experience these endorphins that really make you feel good and have energy and stay young and healthy. Like, studies show that men after a heart attack who have an orgasm at least twice a week decrease their risk of a recurrent heart attack by 40%.
That's pretty high.
40%.
That's great health.
Women who have regular orgasms live about 5 years longer than women who don't have orgasms.
So,
and do you know how many women I talk to that think that they are supposed to stop experiencing intimacy because they're getting older? No.
So I'm gonna bust a rewind a little bit like a bouncing ball. So you said,
I see it.
Dr. Mill,
Dr.
Mill Cowan, Me Bella
B3
Wellness,
specialist.
B3 specialist
Board
said
certified.
that, board certified, can't forget that. She said that having sex at least I'm gonna slip up, well, I ain't on the radio, 2 nuts a week can hold you in the game and reduce heart attacks by up to 40%?
After you have already
After you've already had a heart attack, so you already got heart disease. So I'm saying,
man, that's that
So
now.
what if some men, I can see some men having a heart attack and scared to do anything, thinking they're gonna have a heart attack.
Hey, that's
but
a good point.
you know when
That's
men
great
start
point.
to have heart attacks? When their testosterone declines. Testosterone protects the heart, protects the bones, and decreases your risk of dementia. So women start having heart attacks when their estrogen and testosterone levels are gone. But for men, it's when their testosterone levels decrease, because testosterone naturally dilates the vessel, so it gives a lot of blood flow to the heart to keep it healthy. And when your testosterone decreases, your vessels start to shrink, and that's when men start noticing high blood pressure and all those things. So testosterone is more than just for intimacy. It is for your overall health, well-being, and total wellness.
So if 2 a week is dropping 40%,
Yeah, you need to
5 a week get you about 72%.
Because God gave us a gift,
Lord,
y'all. This is in the Bible. God gave us a gift. Now, I'm a married woman, so I can say God gave us a gift. And that gift is intimacy. And the only way you can experience true oneness with your spouse, and y'all can take it however you want, your man, your spouse, whatever. The only way you can experience that true oneness is regular intimacy. And intimacy may change in your relationship, so you may be a little bit older and you may not be able to do the things that you used to do, but you can still have true intimacy on a regular basis. And women don't necessarily have to have orgasms to improve their health risk, because all women don't have orgasms all the time because they don't see me and I'm not their doctor, because I make sure that all my women know how to have orgasms, and they have hormone balance, they have it right up in their mind, and they got their stuff together, because I feel like I can save the world by making sure that everybody has regular orgasms, and the world will be a better place.
And before we go any further, go ahead and give them a number to get in touch with you with, so that.
Well, guess what? Just because you listening to Benny Mac's podcast, the barber, the
Barbershop
entrepreneur,
Stories
you know,
podcast.
you can text the B3 Experience, all one word, to 44222, and you're going to get a big discount on your ticket to the B3 experience, the climax, on April 4th. And with that ticket, you will also have the opportunity to purchase the VIP ticket as well, which is the teaser, as well as the climax ticket, all for the price of the climax ticket alone, just because you are listening to the Benny Mac podcast.
Now we're gonna add more.
Barbershop.
Yeah, Barbershop Story
Stories.
podcast. Yeah, so I'm gonna add a little bit more to it, just because me are good people. If you ladies or you fellas want to get something for you ladies, I'm gonna purchase 2 tickets to give away. If you call the Barbershop phone 205 591 2887. And we here.
Or cuts.
591-2887 or 591-CUTS. And I'll sponsor 2 tickets because that's what we're supposed to do. Help one another. Now back
I'll send you to the cut part.
Yeah,
Y'all better get them tickets. You don't want to miss out.
Yeah. So, and then let me ask you this though. Like, I hear you speaking about as far as with the orgasm and all that. But is it a certain age where a woman can just be wore out?
No.
No. And what I mean by that is like stretch too far.
I got
Or not like
I
that.
got something for that.
Is it a certain? But I'm saying,
Yeah,
so it
come see
can
that.
happen.
Come see me because I got a machine, and what it does is it improves vaginal laxity, which can be caused by being overweight, gaining a bunch of weight, losing a bunch of weight, having a few babies, especially with vaginal deliveries, but even just being pregnant alone can affect your pelvic floor muscles and cause you to have more laxity. So all those things can actually be treated in a non-invasive, no downtime, painless procedure that takes about 45 minutes, and no insurance does not pay for it. Nobody cares if you have great sex and if you have orgasms, so that's something you'll have to invest in. It's called investing in your health and wellness, which is something we should all be willing to do. But if you want to have great orgasms and you're having problems with laxity, or you're worried and concerned about leaking urine, which is a normal, common thing that happens to women as they age, you cough, sneeze, jump, you can't run anymore, you can't jump on a trampoline anymore because you leak urine when you do that. So a lot of women who have a cold, they have to wear a pad because they leak urine every time they cough as they continue to age, if they're not a Mibella Wellness patient with Dr. Mia, who teaches them how to maintain a healthy vagina and bladder so that they don't have those issues. And if they do, I got something to fix it. So it helps with that. It helps with orgasms. And then I have the O shot. So for my women who say they've never had an orgasm, they can come see me. And it'll take me 10 minutes to get your blood drawn. Then I spin that down and I use your platelet-rich plasma. And I re-inject that into your vaginal area right below your clitoris. Yep, it's a needle, but guess what? You will have the best orgasms of your life, and it helps with incontinence. So it also keeps you from leaking urine when you jump, cough, sneeze, and now you can't work out anymore because you're ashamed and you tired of buying pads. And pee does smell. So this, you know what? You can keep your grandmother. You can, as you become a grandmother, you are more likely to stay out of a nursing home if you can prevent incontinence. That's the number one reason why people put their loved ones in a nurse, because you can't take care of them. So if you can't wash them good and you can't keep them from getting ulcers and then they get immobile, if they can't use the bathroom, that's one of the number one causes of going to the nursing home. However, if you are a Dr. Mia patient, you won't have those issues because I got something to prevent it, and I have something to treat it if you're already having that problem. And that's my goal in life, is to make sure that women can live their best lives, and a big part of that is going to be intimacy, feeling good about yourself, being confident, so that you can give to the world what you're supposed to give to the world. And I do that every day because I'm balanced. I get my pellets, I take my supplements, I take my pills for my crazy medicine. I got a lot of mental disease in my family. I go see my psychiatrist once a month. Everybody should have a therapist. I exercise, I eat as healthy as I can, and I work real hard to maintain a healthy weight, which I'm about 10 pounds over now, but I'm gonna get it off. But it's always a constant struggle, but that's the reason why I can live the life that I'm supposed to live. I have the energy. People don't mind being around me because I'm not irritable and mean and negative because my hormones are off. So get some balance in your life and you can live your best life.
Well, let me ask you this, Dr. Mel. He's speaking about the different supplements, and I know you supply them. Is it, are they natural?
Yes,
Is
all
it-
natural.
is it-
They don't
is
have
it-
any
is it-
toxins.
any
So
side-
all
any side
supplements are
effects?
not created equal.
Mhm.
So you can't go to Walmart. Like I used to tell my patients, go and you got some thyroid issues, get you some selenium, get you some iodine. But they were just going to Walmart and getting some pills off the shelf that have crap in them. And most of it is sugar pill. So that's why I developed my
So
own
it's
line
some
of
expensive
supplements.
sugar
Yeah, and my supplements aren't expensive. They're high grade, high value, high quality, and they don't have all the toxins in them. But they're not super expensive. But you are getting what you think you're taking. So I mean, it's been really helpful for me. Like even in the end of the day, like my mom was like, "You have got to be tired. You have to be tired right now." I'm like, "But I'm really not tired. Like I'm good. Like I can go home now. I'm probably not gonna do any like real work. I may work on a little marketing before I go to bed. Check a few emails. My baby probably gonna be close to being in the bed. Talk to her. If my husband feel like talking to me, I talk to him, and then I go to bed at about 11 at night. But I'm by no means tired. But I got up this morning and I did boot camp. I had to be at boot camp at 5 o'clock this morning. But that's what happens when you have total balance between your supplements, your hormones, and your neurotransmitters. Some of us, we black in America. I mean, you got to have some kind of anxiety or something just walking down the street, okay? So treat that stuff so it doesn't control you and you can have total balance and live your best life. You probably need to come. Let me check your blood work and see what's going on with you.
Well,
B3
you
experience.
said between 8 and 1100.
Yeah, wait, 110.
800 and 1100.
Yeah, I'm probably about 12, 15, 13.
Yeah.
You're
But
way
if
110.
I had to guess, I would say it's about 790.
Really?
Yeah.
Yeah, because you want me to stop through there and you get the big
You don't need it. You don't need it.
Oh, no.
You don't need it yet. You're too young.
Well,
Like my husband didn't need it till he was 46.
Oh, yeah. Well,
Yeah.
I'm just 40.
But he a naturally like muscular dude. You know what I'm saying? So he probably has a higher amount of testosterone anyway. But he still needed some testosterone, and he just got his pellet Monday, honey.
So
and I got mine Friday.
Well, let me ask you this. So if, a woman come in there from watching this and they say, okay, look, I want to get the B3 experience. I want to get the balance and the beauty and all that, the boldness, the whole nine, the belief, the 4 B's. They want all of it. Do you recommend that if that woman take it, that the man should take it too, or just depend on his age?
I think it depends on his age and his levels and his history. So, but the reason I got into male, intimacy is because I treat so many women, and that the husbands always think it's the woman, and so when she get her pellet, she's straight, and then he realized like, wait a minute, So then I check his levels, and they starting to go down. So now everybody's happy because everybody's balanced. They're happier, they're healthier, and they have a lot more orgasms in that house, and so the whole house is just a happier place to be.
So, and they ain't having no heart attacks.
And they decreasing their risk of heart disease, dementia. They got good memory. They smart, kind, and important.
Coming up short on some of those orgasms for some of those women that you said you prescribing those old shots. What you said?
Old shots. Bavi.
I mean, we know the myth is sometimes dudes that can't get it out of them. So is that part of
that's a part of aging.
Sometimes a guy.
That's a common thing with age, especially.
Not just age. Included. People just say this dude didn't know what he was doing, or he didn't know how to make me have orgasm.
No, it's not a man's job to make a woman have an orgasm.
So
Okay, it's my job for me to enjoy my sex.
You better
And
wear
it's
You gotta focus.
right here.
And
you
it's
hitting
my
it live.
husband's job.
You talking about like right up under the Darth Vader helmet or in the
Yeah, a
Darth Vader
little
helmet?
under the helmet and above the shaft. But it
That's a soft spot,
but
though.
listen what it does. It regenerates blood flow.
Oh, okay.
So as you age, you lose blood flow because you old, and so your vessels start to constrict. But this opens your vessels up and makes new vessels, so you have more blood flow. So like when you were 20 years old and you had all the blood flow you could have in the world, you like the 20-year-old, and you probably may have forgotten. You don't think that that's gonna be a big difference, but trust me. Just like women say, I got a good sex drive, but they get their testosterone, they're like, oh. Or they're like, I have orgasms, and they get their testosterone. They're like, oh my God, it's so much easier to have an orgasm because it's so much hormonal as well as structural as well as mental.
Okay, well, doctor, I have several questions.
Oh, I love talking about
I know
intimacy.
Sam got 172
Intimacy
of them for you too, but I do want to ask you this. All right, let's just say the guy go gets the P shot.
Okay.
is that a temporary relief? Because you said new vessels and blood flow increases.
Well, they continue to age.
What I'm
So
saying,
some men
like,
get it.
how often would they have to go get the P shot?
Some men need it every 6 months because they may have real issues. So there's some men who've had their prostates removed for prostate cancer, and they can go get a procedure called the shockwave, or come get a procedure at Mibella called the shockwave, which is where you sit there and they use radio frequency to open up the blood flow again, and then we can do the P shot. But those treatments, you get those treatments probably once a week or once every other week, and you end up getting anywhere from 3 to 12 treatments based on your issue.
Okay, hold on. K1, just in case you missed this, she said males can get something called the P shot, where you get shot
with your
in the P.
with your platelet rich plasma from your blood, so you're not putting anything in somebody that wasn't already there. So you're taking your own blood that your body's used to. We spin it down real good. We take that really rich platelet rich plasma, and then I shoot it in to 2-2. Now,
That's
I mean,
real
that's
serious
probably
stuff,
that's like that.
That's interesting.
Like
though, 'cause I
y'all
never
probably
heard of
wouldn't
that.
need that. But
Yeah.
say you 60 years old and you and your wife still active, and you starting to notice some changes. Well, we have something
That
for
fix
you.
that.
Yeah, that can fix it, and you can enjoy intercourse and not pretend you some you not. Everybody's body changes. Women start to have a drier vagina if they're not getting hormone replacement therapy.
Sad,
So they
man.
notice that they need lubricant. My favorite one is organic coconut oil, by the way.
Hold on. You said you can use coconut oil
Organic.
instead of KY?
Don't use that KY.
No, because I know.
You ain't-
No,
I ain't
no,
told you this before.
no. What I'm trying to see, because I know you fat, but I know they finna know you fat. Now you said KY jelly and Astroglide you don't recommend it, but you can use natural coconut oil.
Organic that you got for your hair, you ought to be putting it on your legs. See why my legs don't look ashy online.
So is it with the organic coconut oil? Is it
You can put
for
it
the
on
guy?
him and or you.
Okay, so he can put it on him, or
Or
she
she
can
can
put
put
it
it on him.
Well,
I
she
think
put it on him.
that's the best way. Let
If
her
she-
put it on him.
If she put it on him,
And-
he may not last.
Yes.
Shit. It might be long before it gets started.
Well, he should come and
Out the
come and
gate.
get a P shot
the
and
big
get
gate.
some shot treatment.
Yeah, he might. Hey, I mean, but see, I hear you talking about the P and the O shot and all that. But couldn't that be based off the level of interest in that person?
It could,
That
and
won't
now I
let
do
him-
say it's not just structural with the with the vessels, because for women it's vascular too, because you have to have good blood flow to the vagina to have the sensation that you need for enjoyment. So as you age and you don't have estrogen, you don't have that same blood flow. What were we saying?
Oh yeah. Pretty
What
much
were we
fine.
saying?
Nah, we was talking about using the coconut,
It'll be the
the
interest.
KY.
Yeah, so the
It could be
interest.
the
So
interest, yeah.
it could be the hormones. So your hormones change. It could be that things don't work as well because of lack of blood flow. It could be mental. It could be that you got so much going on and you kind of got a higher anxiety anyway. So when you trying to have intimacy with your husband, you're thinking about picking the kids up
People.
tomorrow. You know what I'm saying? All of that. It could be because you don't enjoy it anymore, or it's painful because of the dryness. So you have an aversion to it because you know it's not going to be comfortable for you. So it's a lot of different reasons, but I think making and then some people it's therapy, trauma. I mean, trauma has happened to us.
You
You
tripped
know,
me out about that coconut.
a lot of people have had, women have had trauma and they can't have orgasms because the way they look at intimacy is totally different because of their past experiences. And the same for men, unfortunately. There are many men who have had trauma, and so it is their sexual intimacy may be a little bit different, because even if you may suppress that trauma, if you don't ever get therapy for it, you can only suppress it for so long and it's going to come out, and it can affect you sexually. You know what I mean?
Thanks to Me Bella Wellness, I now know that you can use
Organic coconut oil for vaginal dryness. But what I
slay.
do for my patients is I make sure they don't need organic coconut
Oh
oil.
yeah, but no, but I'm saying that was an interesting fact to know, because I remember.
Yeah, that is organic
like,
coconut
we-
oil.
I ain't never had to
Wow.
experience that, but you know, being my profession as a barber, we hear so many things. I've never heard somebody say something about using coconut oil. Never.
Yeah.
Not down there.
Never. So do coconut oil, like I know a lot of times with condoms, they say when you use certain things like Vaseline and all that, it can make them pop.
Well,
What
yeah.
about coconut oil?
Yeah, I wouldn't trust you with a condom
so
now.
the coconut oil is reserved for slaying raw.
Correct. For my
Me Bella Wellness, y'all make sure y'all visit her.
Yeah.
B3 Experience, she fat. But
Yeah, you
like,
gotta be
not
careful
good.
with those condoms.
Oh, okay, yeah. So I was
So
wondering that
be
because
careful. They need more of a water-based lubricant, I think, versus an oil-based and organic coconut oil.
You told me something new
So
then.
you have to be careful with that.
How long does that pea shot last?
So it depends on the person and what's happened. So if it's somebody who had their prostate removed, they may need it a little bit more frequently, but usually it's not more than every 6 months, and for most men, it's probably closer to 12 to 18 months.
That's better than Viagra then, huh?
Oh, it's much cheaper too,
Oh man.
because Viagra is how much a pill?
I
I can't remember my
I
last
don't
quote.
know.
I want to ask y'all, but
That's
it's really high. But if you won't need
I heard
Viagra
it.
with the pea shot, and then if you needed something else to help with the blood flow, we got another non-invasive pain, minimal pain procedure when you're talking about the male.
How about that?
Minimal pain. But for the woman, the Vivive is no pain, and the O shot you're gonna feel when you get the initial stick, but after that you're good. And the same for me. And I stick you, and I give you a block, so it's gonna make everything numb for about 10 minutes. So
What you gonna knock me
then.
out with? What you gonna knock me out with? Walking up
Just
on me
do
with
it
a
one
needle.
time, and then you won't even think twice about it.
So
Especially if you're 60.
because see, I know with the needle, and if you shoot a dude in the side, there's only so much girth.
But it's
It
a
don't come
short
out the other
needle.
end. Okay, it don't
No,
come out
it's
the
a
other
really
end.
short needle, and it's really skinny. Like it's like one of the smallest needles you can have. It's the same one we use to put like Botox and stuff in.
That's hard to imagine. That's all.
Yeah.
That's hard to imagine.
Yeah, and it's hard. Yeah, but let me tell you, the men who really have real dysfunction,
That's what you got to ask.
what?
Hold on,
He
hold on.
said, he said, where you shooting it at? We
Yeah.
can't use
Oh,
outside.
okay.
Yeah, she's shooting it.
Right up under the helmet.
Yeah,
Right.
yeah,
The
right.
helmet right here.
But you know
Right
what?
down,
I numb you. But the
and right
shot
down.
that you feel is too close to the shaft, and I just numb you at like the 2 positions on there. I numb that, so you feel a little bit of needle, a little bit of sting, and I let that sit while I'm doing something else to be helping the other part, and then or I just leave out and come back in 5 minutes, and then you numb.
Now, this may sound like a dumb question, but considering we have a doctor here, and I'm a semi-doctor, and I'm in school for it, when the guy get the pea shot, does it have to be erect, or
It's
or
not
the,
erect.
or the 3 ball?
We have to hold it up.
Swimming pool. Right?
Yeah, so I got the 3 ball look. Okay.
Yeah.
Let me ask another question about before we move too far. K1 brought that Viagra up and the pea shot and all this stuff, Cialis and the stuff at the gas station on the counter.
No, do not use the stuff at the gas station.
Tell you one little time, you'll drill some. All
Don't
that.
use the stuff from the gas station.
So with all these enhancements,
This
kind of like
water is so good, isn't it?
I'm telling you what my one of our old shop mechanic told us.
What'd he say?
Said you keep on using that gas treatment, you gonna need a motor. Cause it's like you keep on, you know what I'm
And
saying,
then a
pumping
lot
it
of
up,
men
pumping it up,
start
pumping
early
it up.
when they don't even need it. So then they get to the point where
They
things
gotta
don't work. Yeah, and they gotta have it, and it's not.
What's the recommended ages, or is it just
It's
when
if you having a problem having
you
an
have a
erection, but not just because you like, ooh, I want to keep my erection longer. You know, you don't do
just
it for
want to just
that.
beat the brakes off? So
Yeah, just get your pea shot.
so
Pea shot.
safe.
The pea shot.
Yeah. So other than just having problems, you probably need to wait till maybe older age when problems do
But now it's some young guys who want to stay like they was 25 and they come in there and get their stuff for maintenance.
What's gonna
and
happen
for
when they
prevention.
45 though?
Nothing, as long as they're not doing the Viagra and the synthetic stuff. If you just maintaining the blood flow, you just should never have a real issue.
Okay.
So I think, and like, even
So
for
the pea shot,
my
not to cut you off, but the pea shot has no side effect, no back,
and I
cause
got
down
a
the
book
road.
on it.
Yeah.
It's been no negative side effects from the O shot or the P shot.
That means
Now there
it's all
have been some
organic.
women who got the O shot, and for that first week, their drive is so high that it could be dangerous for them.
How can it be dangerous?
Because
Like,
they
it's
like
that high.
it's because their drive is high and they just have to have like orgasm after, but that's like 10% of the people who get an O shot. But you have to tell your patients that so they know and they can be in a safe place. You know what I mean? And like at home with their husband.
Not the club.
Right. At home with their husband. But that would be like one of the things
Not the
that
sober
but
saving
nothing
part.
like anything major where they've had to go see a doctor when you are doing the platelet rich plasma. Now, if you're talking about doing other fillers and stuff, because people do fillers because they like their flower to look a certain way. So they make sure that the flower doesn't start to droop and sag and that the small lips don't hang out from the big lips. I mean, we keep her pretty and we keep her healthy, and we keep her very functional and very sensual.
Well, I was about to ask you that because I had a couple people ask me to ask you this question. So because they didn't want to ask. When on a woman, if the lips on the outside looking like saloon doors, what does that mean?
Salami.
Salami,
Like
yeah.
a salami
Yeah,
sandwich where the meat
dog.
kind of hanging out. Okay.
Yeah, what the meat
So
hanging
that
out. What
just
that
means
mean?
that you're aging and your body is changing, and that is the natural and normal thing to happen. However, you can't keep the flower pretty. And just like you can keep the face pretty. You see my forehead doesn't move? That's because I get Botox because I don't want wrinkles in my face. So just like I'm going to do my face, if my little girl starts to sag, you know, you may have to do some things to make the little girl not sag. Because what happens is when the lips start to hang, they get in the way of intercourse. And so if you already aging and you having some vaginal dryness, when he's trying to enter, it's like pushing those lips in. It's already like some dry, thin skin. It just messes up the whole mood. So by making sure that everything stays in order, whether that's naturally or whether that's with some non-invasive, painless procedures, that's just what you do. Just like you keep your face, this is what I tell my patients, just like you keep your face pretty and you start buying all those expensive creams and cleansers and stuff, you got to do the same thing for your vagina. So before you have a problem, your gynecologist should be prescribing you something to maintain healthy vaginal tissue so you can always have orgasms.
So if it look like a hamburger on two buns sideways,
And
that
then
mean
it's kind of
healthy.
hanging out, so you need to come see me and I'll fix
What
it.
I'm saying, like if it look like a hamburger bun, it's good. But
Yeah,
if it's hanging on the outside,
but if
I
you
mean,
got the stuff all hanging out, because what happens is you got the what we call the bigger lips. We call them the labia majora. So those are the big lips, and then there's some little teeny lips in there. Those are the labia minora. Okay, and then it's different glands between those lips that help with lubrication. But as you age, that skin starts to thin because you lose collagen. So that's why doing the estrogen and the hyaluronic acid or the vaginal restoration, that all will help with the aging process to maintain your intimacy and your function and your enjoyment.
So I'm glad you said that because in the hood, you know, cats be saying stuff like, man, that thing fat.
Exactly.
And you know what I'm saying? Like real talk. And most dudes be like, man, that thing ain't fat. So you actually saying if they're on the outside like that.
But if they
they
saying
really-
fat, it may mean they're plump and they not like all hanging and
Oh
jiggling.
no, I know what they talking about.
Oh, they
talking
saying-
about what you just said.
Like
they needed
hanging
some
lips,
help.
they in the
Yeah,
way.
they say they call that fat.
Oh,
Like
okay.
they be like, that thing ain't fat. You know what I'm saying?
Oh.
Then, yeah, you know what I'm saying? That thing, woo, all that. So
But
basically,
they saying that's good.
yeah, in a good way.
Oh, okay.
Yeah, they saying in a good way.
Even if the lips hanging and flopping all in the way.
Yeah, because I guess if it's moisturized, that's
Oh,
for
okay.
lack of a better term, if it's moisturized, I don't think the average cat, it really matters to them. But you're saying that if it's like that, it
No,
probably
I'm not
need-
saying fat. I'm saying
No,
so-
I'm talking about what you talking about.
No, we
But I'm
not
saying-
because no,
but
let
see,
me tell you
no,
because
but
it's
in the hood,
different.
they
If the
refer
big
to it.
lips aren't fat, they droopy. So
But
they
then
not
I'm saying,
talking
what I'm
about
saying,
droopy.
even with the droopy lip, they be like, man, that thing ain't fat, because you normally see in panties first. So they be like, man, that thing
Well,
ain't
tight,
fat.
tight
You
these
know what I'm
days.
saying? Like real talk, in tights and all that, they even look at it as a good thing. So you're saying that them lips on the outside, they need to go see.
Well, if the
get better
little
awareness.
lips are on the outside of the big lips, it's
So-
gonna affect you functionally.
So it's more than
and-
one set of lips.
Yeah, it's two. So it's a nice
God
thick
damn.
set of lips that are on the outside that have the most hair. And
Mm-hmm.
you got some little bitty lips in there that don't usually have hair on them. But you
Mm.
probably can't tell now because a lot of women get waxed and stuff.
Now, I ain't know two sets of lips now.
It is
man. Now,
the labia majora and the labia minora.
K1,
So
did you
when
know
you
with two
spread
sets of lips?
when you spread the big
I
set of
heard it
lips,
one
then you
time.
can see some little bitty lips right there. And then when you spread those lips, that's where the vagina is. And then above that is the clitoris.
It's the clitoris.
And
Now-
well, actually, between the clitoris and between the vagina
Mhm.
is the urethra.
Mhm.
But around that
That's
urethra
where the
are the
urine come out.
skenes that, yeah, the urine comes out the urethra. But it's some little glands over there near those little bitty lips up at the top by the clitoris.
Mhm.
And those are the glands that squirt.
So, I'm
what I
glad you
was gonna
said that. I'm glad, boy. Go ahead, get it first. Get it first. I
She
get it.
going,
All
she going in
women-
there now.
Can all women?
No, all women can't squirt, but having a balanced balanced hormones, maintaining your tissue, keeping your lubrication, but the old shot would make women squirt who've never squirted.
So,
And you don't necessarily have to squirt to enjoy intimacy, but it's the same stuff that's in male fluid. the prostate specific antigen, the PSA. They have actually extracted that out of squirt for women, but for some women they think they're urinating on themselves because it still comes out of the urethra, but it's those little skin glands that are right there next to it, that when your tissue is healthy and lubricated and you're young and you have a young vagina, you can have that squirt thing with enjoyment. But most women don't squirt, but at Me Better Wellness Center, we had an O shot, and if you want to have the experience of squirting, your best chance is with the O shot.
But see, cause that was a debate for a long time, like, and a lot of guys were like, she ain't squirting, she's urinating. So
it's a
it
big
is
difference
such
in the
thing.
smell too.
So it's a certain thing.
It doesn't have an odor.
Mm.
When you pee, it smell like pee.
No.
And you know, women could urinate during intercourse. Men usually can't because that is blocked off. You can't do that. So that's why most men have to actually wait, you know, to go use the bathroom, whereas a woman gets up and she goes right away because of the pressure of the bladder that's right there at the top of the vagina, where the G spot is. So okay, let's imagine. That. Okay, this is the lady's legs. Okay. And let's imagine that those are the big lips, and it's a little clitoris right there, and then it's a vagina here.
2 cents a lip. Boy, 40 years and I just found it out. But go ahead.
I can't remember what I was saying.
Yeah, the lips.
The lips right there.
Yeah.
Okay.
Uh-huh.
So the G spot is if you put your finger in the vagina, but it's right at entry. And God made it that way. That's why some men are well endowed and some men aren't. But regardless, everybody should be able to have orgasms because God made it where the G spot is just right there on entry.
So
right there. So
deep.
whether you have, you don't have to do all that. You got to know what you're doing.
So like that, so
right there. And so when I do that O shot, is you see that clitoris right there? Okay, and then you see the top of that vagina right there. I'm gonna put that O shot there, and it's gonna have that platelet-rich plasma. Them blood vessels gonna wake up. You're gonna get all this blood flow there, and you're gonna get all of this.
Hey Sam, upon entry. So upon entry, hey,
where them UEs come from.
And no, insurance does not cover the O shot. And no, insurance does not cover the P shot. And no, insurance does not cover pellets. That's something you have to invest in if that's how you're trying to live.
Is that an expensive treatment?
Well, it depends on.
When I say
value.
expensive,
So to me.
And the reason why I say that because I'm
it's
sure
not expensive because I get value out of it.
Yeah, because see, the reason why I say that is because.
But if you want to know the price.
Well, I mean, you ain't got to necessarily say the price.
I say the prices. I'd rather everybody know
What's
so
up?
they're not calling the office talking about they want this O shot and they're going to run their insurance for it because it's a waste of everybody's time. Insurance is never going to pay for that.
It is taxed.
So for women, the O shot is $1,500. For men, the P shot is $1,200.
But
for men who having a real problem with erectile dysfunction, they can have their treatments for less than $3,000. So if you telling me, so everybody get income tax, right? Not for real, you don't. But you can, if you want to invest in your sexual function, you can either buy a whole bunch of Viagra, or you can invest in your function and have real function.
So basically, a year worth of Viagra is equivalent, but it's better to get some natural.
Yeah.
But,
to fix the problem, because Viagra not fixing the problem.
Yeah, it's just kind of.
Yeah, so it's kind of like when you have PCOS, I can give you some birth control pills to control your bleeding. So like if you got insulin resistant, I really need to treat the insulin resistance. That's the problem. So if you got problems with sleep, decreased sex drive, decreased orgasm, night sweats, low energy, instead of you getting on 5 different medications that your doctor gonna give you, I can fix your testosterone and all of that'll go away. So you don't need all those pills. You don't need all this synthetic medicine in your body. You need to just balance yourself out. And you don't have to take all those pills. They cause something else. They cause another problem. And you take another pill to fix that.
So when the cat goes to his regular physician and say, Doc, I need such and such, man.
He gonna
keep getting you that stuff that just basically stringing you along.
Because what doctors do is what they taught. They don't. So a lot of doctors don't go and do research. I research. So I started doing the pellet because when I realized I wasn't helping my patients with what they taught me to do, I went and researched and I figured out what worked. I talked to a bunch of people. I read a bunch of studies. And when I finally found a company that I was comfortable with, I knew I was going to get good pellets. I started the pellets. But I did it after research, but I didn't just go with what they told me in residency, because what they told me was to get them some horse urine, estrogen, and progesterone, and that'll help their
Horse
symptoms.
The real
That's
horse
what
urine.
Premarin. Yeah, the Premarin is
The
made from
real
horse
live.
urine.
Ooh.
So I use plant-based stuff that God put on the earth, and I'm using it naturally.
Well, they
and-
did
What
put
in the
horse
hell
on there,
is
too.
horse pee?
I ain't never heard
Don't
of
Yeah,
make you
put horse-
slaughter something.
You put horse down too now. But no, but how
Yeah.
do
That
they
bottle of
horse
gin,
pee?
K1.
Is it
Because you can
supposed to
get
be
the
strong
estrogen,
in?
because they
No,
still a
okay.
woman. You know, it's still a mammal, so they all
Yeah,
got
yeah.
the same hormones. So you just using horse hormones instead of
Who the
plant.
hell?
But the plant hormones look just
Trying to
like your
knock a
Who
wall
hormones.
the
out,
hell
motherfucker.
was the first person? You know what? Their horse pee fat.
But see, the difference is too is that it's people making a lot of money off Premarin.
Yeah.
They not make. I mean, they make money off the pellets, but not to the extent that Premarin.
Yeah, yeah.
You know, they making millions and billions of
Tell
dollars.
them niggas that
off
horse
of it.
pee in. Their
Yeah.
wives didn't stop making that
Yeah.
shit.
Yeah.
Most niggas ain't read what's in that shit.
That's a new one though, Mia, because you know, like I don't know if you ever heard this with the athletes. They was talking about deer antler juice. But my question is, who the first mofo?
But you ain't
know
had
what
no
I'm saying?
deer antler juice. You need some damn testosterone.
Yeah, that's what I'm
Yeah.
saying. Like,
Testosterone.
what I'm
That's the
saying,
problem. Your testosterone
That's
decreases.
crazy.
Replace your testosterone.
Mm.
You know, if you need gas in your car, you go get gas.
Yeah,
you don't
right.
start working on the generator.
Yeah, you got a
You
point.
go put gas
Don't
in
put
the
no
car.
transmission
So
fluid
fix
in
the
it.
real problem. Don't put a band-aid on the problem. Fix it.
Mm.
At the top of the hill, not at the bottom.
You got
That's
to
up.
you got to
That's
point
mine.
out.
And have lots of orgasms
Really
so we can
very
save the
nice.
world.
You right though, cause if most people having, hey, if
You happy.
you getting it off your chest
Right.
on a regular basis, you ain't got nothing be walking around here. You know what I'm saying?
Especially with somebody you like really love and you trying to like, you know what I'm saying?
Yeah.
That would make them finances hit harder.
Right. Everybody work hard. Everybody happy
The
to go to
finances is
work.
the problem, dog.
Nope. It ain't just finances, but this is the thing about marriage and intimacy. If your intimacy is good in your relationship, it'll help it by 20%. But if your intimacy is bad in your relationship and both people aren't pleased, it can affect your relationship 80%. So if it's good, it's gonna help a
80-20.
little bit, but if it's bad, it's gonna mess it up a lot. So you gotta make sure that is, and I mean, and that's like you did a covenant if you married. Like you can't just tell your partner you don't want to have sex and don't go figure out why and try to fix it. Like it is in the Bible that you are not supposed to tempt your spouse by withholding sex unless both of you agree and it's for religious reasons.
No,
And
the
that's the
Lord said.
only reason.
Yeah.
But other than that, you are not supposed to deny your spouse. So if you're having problems and you don't want to and it's an issue, you should
Just
love
tell them.
yourself and your
Yeah,
spouse
both of them.
enough to go get it fixed because it's not normal. 85-year-olds should still be able to have sex. It's a gift from God. He don't give us gifts and take them away unless
Now-
we don't use it and don't respect it and appreciate
Now,
it.
ladies and gentlemen, the words from Dr. Mia, Me Bella
Wellness.
Wellness. She said, if you do not distribute them yams, you might need to have a reason why, or at least communicate with your man. Now that was fine.
Because that's a big deal for me, and that's what I tell
That's
women when they
huge.
come see me first. I said, so now what you gonna do? Because I'm like, so you're saying that you have a decreased drive. So how often are you having sex? And they're like, I had sex with my husband for 3 months. I'm like, you ain't had sex with your husband for 3 months.
You know what he
That
doing?
means he's some exercise.
You know what he doing? He's working hard and he's waiting on her to get better.
And he's cheating.
I don't
And
know.
not-
Black men
not-
don't cheat. Black men don't
That's so
cheat.
stupid.
Hey, that's what they said. Now, that's what they said. Ain't that what they said?
But
She
you're supposed to go
cheating,
get it
man.
figured
Shit.
out.
Yeah, I just say, yeah.
It's not
She
okay to
might
just
be.
be like, I'm getting older and I don't want to do that, and my spouse does. Now, I have some patients where they experience intimacy a different way. Because it may be that the husband had prostate cancer and he can't have intercourse anymore, or that it's so painful for the wife that he doesn't want to hurt her, but they still find a way to experience oneness. So it doesn't have to be direct, normal, vaginal intercourse and, penile intercourse. You touch is intimacy. Cuddling is intimacy. You know what I'm saying? Pillow talk is intimacy. Doing fun things together, that's intimacy. But you need an intimacy that includes your oneness. And a big portion of that for men is going to be physical intimacy. But again, over time, that changes in your marriage. What real intimacy is and what works for both of y'all.
I've been shown up,
Super.
educated.
So it's not just sex.
Mhm.
Intimacy is not just sex.
Lord,
That's why me and my husband going dancing, and he gave me dancing lessons for Valentine's Day.
Joe.
So I called him the other day. I texted him, I'm like, hey, what are you doing Sunday at 4? Because I can't dance, and I really want to be like one of those old women with her husband dancing at all the parties, and everybody be like, ooh, they know they can dance. You know what I mean? Yeah.
So let me ask you this: what y'all doing? A running man or something?
No, so we going to the. I ain't gonna get them no shout out yet because they ain't gave me no ambassadorship. But we going to this place where they got a great dance class, and you can learn different kinds of dance. But I need to learn how to dance in general. So I text him and I said, "What you doing at 4?" And I said, "Thank you so much for my Valentine's Day gift. We have dance lessons.
Twerk or dance?
Dance, like for real dance,
Like
ballroom dance,
like
ballroom.
and what you call the Latino one?
Salsa.
Salsa.
Yeah,
They teach salsa. They teach all of it. But I want to learn all of it because I want to be that little old lady that's dancing with my flats on, but they real cute.
That's what's up. That's what's up.
But they're real cute.
Yeah, to get that in.
Some
by
bling
two.
tennis shoes or something.
Well, that's what's that now, Dr. Mill. Now you know.
And that's intimacy. That was my point.
Oh, yeah.
Recreational
That's true.
intimacy. So doing fun things together is a part. So
Like the foreplay, right?
men is not just physical intimacy. You got to let them women. A lot of women, for them, and for some new women, it's all about the physical. But for many women, it's the emotional part too. So the cuddling and the pillow talk and to get them ready before, not just like you ain't said nothing to them all day and then all of a sudden you feel like they're just supposed to lay in the bed and be excited. And then they got to go get up and then go wash all the clothes, clean up the kitchen. One of the best ways you can get regular intimacy is to make your wife's life easy.
Now I will say this. Now that was great about the dancing and the cuddling and the smelling the
Help
chicken
your wife
cooking
clean up.
and the smelling
Go
the
wash
chicken
some
cooking.
clothes. Go
All of
cook
that.
some food and wash some dishes.
But Mia,
And she will be so in the mood just
I
because she
know.
came home to a clean house with some dinner cooked.
after all that dancing, you're gonna have to get about them yams. I feel you. Yeah, I
I
feel
don't
you.
have a problem getting up off my yams.
Well, I
enjoy getting up off
Not
my
you.
yams with my husband.
I mean,
y'all
not
better
you.
learn how to
Not
enjoy
you
with y'all
because
husbands.
you the pill distributor, so I know
Right.
you're gonna keep a couple
I'm
of them yourself.
balanced.
No, you ain't talking all that noise, but nothing.
Yeah, I know. You know what I'm saying.
She taking her time.
Oh yeah, but that's interesting though because a lot of people I think they have it wrong about how all this go. But it's just interesting about those pellets and all that. So now, once again, how do they get in touch with you so they can come see Dr. Mia and me, Bella Wellness?
Go to mebellawellness.com. You know what? You could really just put in DRMI and I'll come up. So you can Google Dr. Mia. You like that?
Doctor.
Just Google me. No, but mebellawellness.com. You can follow me on Facebook, Mia Cowan MD, or Me Bella Health and Wellness, and Dr. Mia Cowan MD on Instagram. Go to text 244-222 44222 the B3 Experience to get your discounted ticket to the best event Birmingham has ever seen that involves wellness and will involve over 10 professionals that are physicians as well as psychologists, so PhDs, MDs, DOs, and they're going to all be there to share their knowledge with you so you can live your best life. April 3rd, that's going to be the B3 Experience, the teaser at the Avondale, 6 to 9, 629, 629,
Around the corner.
629, right around the corner.
Yeah,
And then on April 4th from 8 to 4, it's going to be an all-day event at the Marriott 280, and it's going to be phenomenal, and you're going to learn how to live your best life and have orgasms for life.
Make the world
Mia.
better.
To make the world,
Make the world a better
and
place.
lower your heart rate too.
Saving
Keep-
vaginas, marriages, and lives, one at a time.
That's right. That's
One
right.
at a time.
Well, it's been a pleasure, Dr. Mia.
I'm so glad you had me on
I'm
here.
glad you came because you could have been anywhere else.
But I want to be here, right here with Benny Mac, the Barbershop Stories.
I don't know why our ladies didn't come out. We usually have the studio audience. They usually come out to check it out. Hey,
They wanted
They
to
should've been here to hear this one.
Yeah.
Yeah, they want
y'all rewind this one, play it for your friends.
I'll be having some events. They can come out, tell them all this face to face.
But y'all make sure y'all check out the B3 Experience April 3rd and April the 4th. They got the teaser and they got the full event with Dr. Mia and other professionals telling you how to reduce them heart attacks by 40%, keep your house happy and nobody out there slipping and sliding.
And take care of yourself and love yourself.
That's right, that's right. And those pills, the pellets, now I ain't never took now, but I
He don't
definitely
need
heard
them
about
yet,
it.
but in about 5 years, he
Oh.
gonna be.
I ain't gonna need them. I probably need about 72, 73, somewhere up in there. But Other than that, though, y'all please go check out
Yeah,
Dr.
you
Mill. She's a professional, and she's gonna keep you right. She's down to earth, and that's what it is. Be better wellness. Anything you want to say in closing, Dr. Mill?
Thank you for having me. This was so much
Hey,
fun.
I appreciate you coming.
I
Appreciate you
know.
coming.
I'll be back. Y'all to see me again.
Sitting
All right.
on our
Right
mind.
here. Barbershop Stories.
That's right. And then of course,
Episode 3-2.
that's right. And always
Thursday.
before we go, we like to thank our guest, Dr. Mill, my homie Sammy No Nose over there,
Keep some info.
and myself, comedic narrator, haircut Schlanger, Benny Mac. And I definitely want to shout out B94.9 Home Team Morning Show. What up,
Home
homie?
team.
What's
Health
happening?
is with the V with
What's
Dr.
happening?
Mill.
That's right. That's right. That come on Wednesdays,
At
8:30.
8:30.
8:30 every week. So y'all make sure y'all tune in. Y'all can hear more every week. The conversation is exhilarating.
Yes, it is.
Very, very, very exhilarating.
Best
on
team in the
D94.9.
world.
Then also too, check out D5 Tax Services. They are the place to go if you want to get your stuff done. Now she gonna give you a free vacation when you file your taxes with her. Go in there and look for Katanya Scott. Tell her Benny Mac sent you, and she's gonna hook you all the way up.
How we get in touch with her?
How you get in touch with Katanya? Now it's running across the screen.
D5. Oh,
Yeah,
okay.
D5 Tax Service.
I'm on
It's
it,
in
too.
Roebuck.
Oh,
Yeah,
okay.
9729 Parkway East. I don't want to say Suite. I think it's Suite 101.
Okay.
But if I'm wrong, don't be mad at. But
Just
D5,
Google GT.
No, D5
Yes.
Tax Service. D5. No, D5.
Google that shit.
Yeah, Google. D5 Tax Service, Katanya Scott. Y'all make sure y'all check her out. And then also
That's
too,
what I done.
next comedy show is March 3rd, Tuesday, March 3rd. That's the Tuesday night laughs at Root's Place. I got the tickets 1 for 15 or 2 for 20. Then also two, make sure you tune into the Home Team Morning Show Monday through Friday, 6 a.m. to 10 a.m. is myself, comedic narrator, haircut Schlanger, Benny Mac, and the homie Jay. We got all kind of topics from here to there. It ain't nothing we ain't talking about. So y'all make sure y'all tune in to that. And of course, this barbershop here, me, myself, Sammy No Nose, Otha Luther King, and Corey, we're here to service you 7 days a week. Hours are flexible because that's what we do. So you make sure you come check us out there. And anybody I forgot? Anybody I forgot? Anybody I forgot, Sam?
Next week,
Yeah, next
we got
week.
old boy,
Yeah, next week we got a
movies.
we got a real live film director up in here. What the name, K1? We're gonna let you introduce what the name is.
Ben Davis.
Ben
Ben
Davis. Yeah. What up,
Barbershop
Ben
Stories,
Davis?
episode 3-3.
That's right,
Got
episode
it pimping,
33.
baby.
That's right, that's right. And then make sure too, you also check us out on YouTube
GTS.
at youtube.com/MacMan Entertainment. Subscribe, like, repost, and share it. We don't mind. We don't mind if you share it. Ain't no problem. But make sure you stay tuned in to Barbershop Stories every Wednesday, 8 p.m. Central Standard Time for all my people who watching all over the world, 8 p.m. Central Standard Time. And also, too, you're looking for a comic, clean, dirty, cussing, or simply church show, hit me up, 205-585-7273. I would definitely bring you the funny for a little money, and it's always something to laugh at. And that's another episode, Barbershop Stories 32, with Dr. Mia Cowan, B3 Experience, and she saved lives, marriages,
And
Let me let you
flowers.
yeah, and
Them
flowers,
flowers
aka in the
figs.
hood, we call them yams. And we are out. We'll see you next
Take
week.
care of the fellas,
Yeah.
too.
Yep.
Pow. Dr. Mill.
That was good, Dr. Mill.
That was fun.
I enjoyed that.